professor, physician, epidemiologist. I am Dr. Sri Banerjee. Hello everyone, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy at Walden University. And I wanted to quickly go over a data set that I learned about just today from the CDC Global Health Conference, and that is the CHAMPS data set. And it has precise, accurate, real-time data explaining why children under 5 are dying. And so there's several sites which you can kind of go and identify de-identified data or access de-identified data. And so level 1 is summarized data, data that has already been kind of processed. So you have frequencies, prevalences, incidence rates, things like that. These have already been determined, and so that is summarized data. That doesn't require any sort of individual level processing or any sort of statistical analysis packages usually. And these days, actually, there's extremely useful dashboards that you can use to provide summarized data. Next level is de-identified data. So summarized data in terms of CHAMPS would actually look like, so cause of death data, for stillbirth, neonate, and infant and child. And these are separate views for all causes of death and infectious etiologies. So you can take a look at these data summaries right quick with the enrolled population data and just peruse through that. So if you looked at the previous screen closely on the top left, and if you didn't, I would pause and go back. 10,527 deaths had been reported in that dashboard. So that's summarized data, but if you want to go behind the scenes, and if you want to actually look at the data, and I have looked at several types of childhood data sets. This sort of de-identified data set is available in the CHAMPS Dataverse. So you can kind of click on this, and then there's actually an R package within GitHub, and I've talked about GitHub extensively. And there's a portal there that you can access and see how to use this. There's also additional limited data, that's level 3. That requires kind of a data use agreement, 4 to 8 weeks. You get access to some of the limited data sets, the TAC results, some of the very important molecular biology sort of findings as well. And then data transformations performed to create the limited data set. And then potentially identifiable data is level 4, and that is you need a data use agreement, and that can take anywhere from 3 to 6 months. So the CHAMPS staff member will contact you and provide further instructions once they receive it. Anyway, so enough about that, but this is a very important data set. There's even a call to action. But stillbirth, neonate, infant, and child, and enrolled populations, there's summarized data on all of that. I encourage you to go through this data set and really try to explore it so that next time you're trying to do research in this area, then you have a go-to place, one-stop shop for several variables. Thank you for listening.